RX stands for prescription. TX stands for treatment. HX stands for history. FX stands for fracture. STAT, S-T-A-T. Stat means immediately, as soon as possible, right now. So stat is immediately. BMI. BMI is body mass index. So a BMI, it's a measure of body fat based on height and weight. BMI, body mass index. CPR. CPR stands for cardiopulmonary resuscitation. It is a life-saving technique. Cardiopulmonary resuscitation. ED and ER. So if you see those, ED is emergency department and ER is emergency room. Thermo. Thermo indicates heat. Cardio. Cardio is related to the heart. Derma. Derma is pertaining to the skin. Encephal, or encephalo, that is related to the brain. So like hydroencephalitis, that would be inflammation because of water in the brain. Encephal is related to the brain. Gastro. Gastro is related to the stomach. Hema. Hema is pertaining to blood. So hematuria is blood found in the urine. Hema. Hema is pertaining to blood. Oste. Oste or osteo, that is related to bone or bones. Pulmon. Pulmon refers to lungs. Rhino. Rhino refers to the nose. Sclerosis. Sclerosis means hard or hardening. Biopsy. A biopsy is a small sample of tissue that's taken for testing to discover the cause or the extent of a disease. Biopsy is a test with a small sample tissue. Benign. Benign is usually referring to tumors or growths, and it means not cancerous. Benign is not cancerous. Malignant. Malignant is usually referring to tumors or growths as well, but this one is indicating the presence of cancerous cells. So malignant means presence of cancerous cells. Cancer. Cancer is a collection of related diseases where some of the body's cells multiply out of control, spreading into the surrounding tissues and interfering with normal body functions. Myocardial infarction. A myocardial infarction is a heart attack when an arterial blockage or slow blood flow deprives the heart of blood. Tumor. A tumor is a swelling or a mass, and it's usually in relation to cancer. Tumor, a swelling or mass. Sublingual. Sublingual, so sub is below or under, and lingual is tongue. So sublingual means it is typically seen with medications that are administered by dissolving under the tongue. Sublingual, meds given under the tongue. O2. O2 stands for oxygen. Incentive spirometry. Incentive spirometry is a handheld medical device that measures the volume of your breath. It is an incentive spirometer. It helps your lungs recover after surgery or lung illness, keeping them active and free of fluid. Incentive spirometry is designed to mimic natural sighing by encouraging patients to take slow and deep breaths. Incentive spirometry is performed using devices which provide visual cues to the patients that the desired flow or volume has been achieved. CBC. CBC stands for complete blood count. TPR. TPR stands for temperature, pulse, and respiration. Phantom pain. A phantom pain is a pain that is experienced and it feels like it's coming from a body part that's no longer there. Phantom pain. Radiating pain is caused by medical conditions that affect the nerves in your body. This results in traveling pain that spreads from the original pain point to a larger area of the body. Conditions that may trigger radiating pain are those that punch or pull on a nerve, such as a herniated or bulging disc. Radiating pain can range from dull to sharp or electric shock-like, and it may come and go or be continuous. It's usually only felt on one side of the body, such as going into the chest on one side, tingling, numbness, or weakness. So radiating pain is traveling pain that affects the nerves. It spreads from the original pain point to a larger area of the body. Allergy. An allergy is a reaction by your immune system to something that does not bother most other people. People who have allergies often are sensitive to more than one thing. Substances that often cause reactions are pollen, well, lots of different things. But anyway, allergy is a reaction by your immune system to something uncommonly reacted to. Hospice. Hospice is an agency that promotes comfort and quality of life for people who have been diagnosed with less than 6 months to live. So the dying person still deserves comfort and quality of life. An indwelling catheter. An indwelling catheter or a Foley catheter, it's a catheter that is left in the bladder so that urine can drain constantly into the drainage bag. Hypothermia. So hypothermia. Hypo is low, right? So hypo and therm is heat, like heat level. So hypothermia is abnormally low body temperature. Hypoxia. Hypoxia. So hypo is low, right? And ox is oxygen. So hypoxia is cells do not have enough oxygen. Delegation. Delegation is tasks that are delegated by the RN, LVN, or LPN to nursing assistants. The delegating nurse is responsible for making sure that the task was completed safely and correctly. The 5 rights of delegation. Number 1, right task. Number 2, right circumstances. Number 3, right person. Number 4, right directions and communication. Number 5, right supervision. NATCEP, NATCEP. That stands for the Nurse Aid Training and Competency Evaluation Program. SNF, or SNF, stands for Skilled Nursing Facility. OBRA. OBRA is OBRA, which stands for the Omnibus Budget Reconciliation Act of 1987. It is also known as the Nursing Home Reform Act of 1987. It has dramatically improved the quality of care in the nursing home over the last 20 years by setting forth federal standards of how care should be provided to residents. OBRA, the Omnibus Budget Reconciliation Act of 1987. Fowler's position. Fowler's position is the sitting position. So standard Fowler's position, also known as the sitting position, is typically used for neurosurgery and other shoulder surgeries. The bed angle is between 45 degrees and 60 degrees. The legs of the patient may be straight or slightly bent. Prone position. Prone position is when your patient or you are lying flat on your stomach, usually with your head turned to one side. Prone position. Supine position. The supine position is when a person is lying on their back with their face facing upwards. They are lying horizontally with the face and torso facing up, as opposed to the prone position, which is face down. So, supine versus prone. Supine. The Sims position. Sims position is a position where the patient lies on their left side with their right hip and knees bent. The Sims position is usually used for rectal examination treatments, enemas, examining women for vaginal wall prolapse. It's performed by having the person lie on their left side, left hip and lower extremity straight, and right hip and knee bent. It is also called lateral recumbent position. Sims position is also described as the person lying on their left side with both legs bent. So here is a Sims position. Lateral position. The lateral position is a position that is described as side lying with pillows strategically placed along the patient's back, possibly the buttocks, and the pillow placed between the patient's flexed legs to prevent abduction and internal rotation of the hip. So, lateral position. Another example of lateral position. SCA. SCA stands for sudden cardiac arrest. Sundowning. Sundowning. That is when your signs, symptoms, and behaviors of Alzheimer's disease increase during the hours of darkness. So late afternoon and early evening can be difficult for some people with Alzheimer's disease. They may experience sundowning, so restlessness, agitation, irritability, confusion, and it can begin or worsen as daylight begins to fade. Often just when tired caregivers need a break, but can't be helped. Sundowning. Suppository. A suppository is a cone-shaped solid drug that is inserted into a body's opening. It melts at body temperature. So if they have swallowing issues or nausea, or it needs to go into the system super fast, suppository. It is a cone-shaped solid drug that is inserted and melts at skin or body temperature. Gait belt. A gait belt is a transfer device. It is a transfer belt. It is a device that is applied around the waist and used to support a person who is unsteady or disabled. So their gait is unsteady. Gait belt. So you are helping them stabilize their gait. Gait belt. WT is weight. CO. CO stands for complains of. So like CO pain, CO headache. So CO stands for complains of. OT stands for occupational therapy. PT stands for physical therapy. ST. ST stands for speech therapy. SB. SB stands for seen by. HOB. HOB stands for head of bed. Seizures. Seizures are violent and sudden contractions, convulsions, or tremors of the muscle groups caused by abnormal electrical activity in the brain. Elopement. Elopement is when a person or a resident or a patient leaves the hospital or facility when doing so may present an imminent threat to their health or safety for medical, legal, or mental health reasons. So elopement is to escape, take off, despite it being unsafe. FWW stands for front-wheeled walker. HOH stands for hard of hearing. CNS. CNS stands for central nervous system, so the brain and the spinal cord. CNS, central nervous system. GI. GI is gastrointestinal. Contamination. The soiling or to make impure or unsuitable by contact. To mix with something unclean or bad. So like you're contaminating a lake with sewage to render harmful or unusable by adding a material. So you are dirty and you are in contact with somebody else and you are contaminating their environment. Contamination. To make dirty with contact. Cross-contamination. Cross-contamination is the transfer of bacteria or other microorganisms from one substance to another. Sterile is free from all live bacteria or other microorganisms and their spores. So sterile is ultimate cleanliness. Palliative care. Palliative care is medical care that relieves pain, symptoms, and stress caused by serious illness. So it is comfort care. Professionalism. Professionalism involves following laws, being ethical, having good work ethic, and having skills to do their work.